My question is to the Minister for Health and Aged Care. What does the Minister say to the residents of South West Rocks, a small coastal community in my electorate, who will now be forced to compete with suburban Sydney to attract doctors, all because of Labor's decision to blow up the classification system for rural doctors?
I give the call to the Minister for Health and Aged Care.
Well, thank you, Mr Speaker, and I'm pleased to take another question about the ways in which this government is seeking to make it easier to see a doctor, because the last government made cut after cut and change after change that have resulted in it being harder to see a doctor, more expensive to see a doctor than it ever has been in the Medicare era. And I'll go to the changes we made to DPA, because the member in his question tried to compare the area he represents to Sydney. Now, what we did with our changes to the DPA, the District of Priority Access, is to reverse distribution priority access, is to reverse a cut made by the former government in 2019 that removed the ability in 140 GP regions of this country to employ overseas trained doctors. And they were not regions in the middle of Sydney. They were regions like the one represented by the member for Hunter, by the member for Shortland, by the member for Patterson, on the Central Coast, in other regional areas of Queensland, of Victoria, of New South Wales, because the former government pretended it was the same process to recruit a doctor in the Hunter Valley as it was in Mossman, and it simply isn't. I visited time after time GP surgeries in regional Australia that had consulting rooms that were closed, consulting rooms without a doctor, and the leader of the National Party might scoff. I mean, they tried to run a campaign in the Hunter Valley. They obviously didn't bother visiting any GP practices in the Hunter Valley, because doctor after doctor in that community, patient after patient, said because of your changes in 2019, it had never been harder to see a doctor than it had been right now. So we make no apology for reversing those cuts. No apology at all for reversing those cuts and making it easier to see a doctor in the Hunter Valley, the community you pretended to represent and failed dismally.
The leader of the Nationals is warned.
What those opposite might want to tell their communities is that I was lobbied.
The leader of the Nationals will leave the chamber under 94A. Order. It's not something to cheer about, government members. Member for Grey on a point of order.
Yes, Mr Speaker. The minister is constantly referring to you and the leader of the.
I thank the member for Grey. The minister will direct his comments through the chair. I call the minister.
Thank you, Mr Speaker, and I apologise to you, because I remember very clearly you supporting Labor's policies to make it easier to see a doctor right through the election campaign. But I can tell you, Mr Speaker, I was lobbied to reverse the changes the former government made, for example, to bulk billing incentives in DPA2 areas like the Hunter Valley, and I resisted that lobbying because I thought it is important that there be continued incentives in more rural and more regional areas, including higher bulk billing rural incentives and higher incentives under the Workplace Incentive Program.
Expired.